Welcome to non-pharmacology treatment, psychotherapy and psychosocial interventions. Psychotherapy and psychosocial interventions are fundamental components of a psychotherapy. So we want to talk about the biological, psychological, and social environment. Psychiatric disorders are not treated only with medication. Evidence demonstrates that the structural psychotherapy can modify functional neurocircuits, improve emotional regulation. So psychotherapy modify dysfunctional neurocircuits, improve emotional regulation, changes adaptive behavior and cognition pattern, improves interpersonal function, reduce relapse risks, and improves medication compliance, enhances quality of life. That's what we want to reach to. Improves quality of life. Psychotherapy improves quality of life. For clinicians, psychotherapy is not separate from psychopharmacology. It is complementary biological and behavior interventions. The objectives of this video include that we are going to explain major psychotherapy theory, apply evidence-based psychotherapy approaches, select appropriate psychotherapy based on diagnosis, integrate psychotherapy with medication management, understand trauma-informed approach, apply psychotherapy analysis, and answer questions. So, fundamental of a psychotherapy. Historical development of a psychotherapy. Psychoanalysis era developed from work of a Sigmund Freud. Central concept of a Sigmund Freud include unconscious process, early childhood experience, defense mechanism, internal conflicts. Modern-based psychotherapy, contemporary psychotherapy emphasize evidence-based techniques, specific diagnosis, measurable outcomes, skill development, behavior changes, neurobiological of a psychotherapy. Psychotherapy produces changes through neuroplasticity. The brain changes to brain. Our brain changes. This theory says our brain changes through a learning, repeated emotional experience, new coping behaviors, new coping skill behaviors, brain system affect frontal cortex, prefrontal cortex. So prefrontal cortex important emotional regulation, decision making, impulse control. amygdala center of our brain, therapy can reduce fear response, treatment sensitivity, hippocampus supports memory process, trauma integration. So cognitive behavior therapy, theoretical function. Cognitive behavior therapy is based on a principle of thoughts influence emotion, and emotion influences behavior. The cognitive model is situational, thoughts, emotion, behavior. Situation leads to thoughts, and thoughts leads to emotion, and emotion create behavior. Core concept: automatic thoughts, rapid thoughts that occur without conscious awareness. Example: situation, friends does not answer a message. Automatic thought is, they dislike me. Emotional, that create emotional sadness and anxiety. Then the behavior would be withdrawal. Patient would cognitive behavior therapy components include identifying the negative belief, evident support belief, evidence against the beliefs. Then you will replace distorted thinking with a balanced thinking. Behavior activation used especially for depression. It increases the meaningful activity, improves mood, include exercise, social activity, goal setting. Exposure techniques include used for anxiety disorder, and it encourages or creates repeated exposure, fear reduction response. Cognitive behavior therapy is indicated for major depression disorder, general anxiety disorder, panic disorder, social anxiety disorder, OCD, insomnia disorder, post PTSD. Cognitive behavior therapy is not simple positive thinking. It is a structural cognitive and behavior skill training. Didactical behavior therapy is indicated for borderline personality disorder, and core philosophy is didactical, meaning a balance to opposite concepts. Acceptance: I acknowledge my current experience and the change. I work toward healthier behavior. So this is the two concepts. Didactical behavior therapy has 4 modules. mindfulness, distress tolerant, emotional regulation, personal effectiveness. So, mindfulness. The mindfulness goal is to increase awareness of the thoughts, emotion, and behavior without judgment. Distress tolerant. The purpose is survival emotional crisis without destructive behavior. Skills include grounding, self-smoothing, crisis survival techniques. Emotional regulation. Goals include identifying the emotions, reducing emotional vulnerability, knowing the triggers, improving coping skills to cope that emotion, interpersonal effectiveness. Skills include assertiveness, boundary setting, relationship skills. Didactical behavior therapy treatment structure include individual therapy, group skill training, phone coaching, therapeutic counseling. Evidence-based usage is primarily borderline personality disorder, also helpful self-harm behaviors, suicidal behaviors, emotional dysregulation. Psychodynamic therapy. Psychodynamic therapy focus on how unconscious early relationship influence current behavior. Major concepts include defense mechanism, psychological strategy used to manage anxiety. Examples are denial, projection, rationalization, displacement. Denial is the refusing to accept the reality. Example of the denial will be, I don't have drinking problem. I don't have drinking problem. And they are drinking. Projection is attributes to one's feeling to others. I am not angry. You are angry. I am not angry. You are angry. Is that sound is rational? I don't think so. That is projection. Projection attribute one's feelings to others. They are angry, but they are telling you, you are the one who is angry. Wow. Rationalization. Creating logical explanation for behavior. I drink it because my job is stressful. I don't think so. Even if your job is stressful, you shouldn't be drinking. Displacement. Displacement is a direction emotional toward safer target. Displacement. Your boss make you miserable. You come home and make your family miserable, which is insane. Okay, therapeutic goals include increasing the awareness of the person, knowing this behavior is not okay, this behavior is risky, this is what is happening, this is what is the reality, even though they are in denial. You are in denial, this is what is happening. So increasing the awareness, understanding the relationship pattern, improving emotional insight. And indications include personal disorders, relationship difficulties, chronic emotional problems, motivation interviewing. The purpose of a motivation interviewing include motivational interviewing helps the patient resolve unbelief finds about the behavior change. Is essentially useful for substance usage disorder, medication compliant, lifestyle changes. Core principles include express empathy, develop discrepancy, avoid argument, support self-sufficiency, express empathy include the active listening, acceptance, developing this discrepancy include helping the patient identify the conflict between current behavior and personal goal. Example, I want a better health, but alcohol usage is affecting my relationship. Avoid argumentative. Resistant is explode. Resistant is explode, not confront. Not confront. Support self-efficiency. Strength belief I can change. You want to use open question. What concern you about your drinking? Affirmation. Recognize the strengths. Reflective listening. Reflective patient statement. You want to reflect the patient statement. Summarize what the patient told you. Review the discussion. Family therapy. Purpose of a family therapy include purpose of a family therapy is to recognize that the symptoms occur within the relationship and the systems. The structural family therapy focus on the family organization, roles, and boundaries. Strategy family therapy include changing interaction pattern. Psychoeducation for family therapy is strongly indicated for bipolar disorder, personality disorder, and the benefit is it reduces relapse, improves medication compliance, and it is indicated for children disorders, childhood disorders, psychosis, eating disorder, substance usage disorder. Group therapy. Group therapy, according to group therapy theory, provides a university. I am not alone. It university. It group therapy helps the patient to realize they are not alone. Interpersonal learning, understanding the relationship pattern, hope. Seeing others improve will help the patient to improve. Encourage them. Peer modeling. Peer mentor. They will get peer mentor from the group therapy. Psychoeducational groups include teaching medication, coping skills, illness management. Process group is focused on emotional interaction, relationships. Support group is focused on experience, shaping experience. And they are indicated for depression, anxiety, substance usage, grief, chronic pain. Trauma-focused therapy, it is what is happening. Clinicians ask what is happening to you instead of what is wrong. What is happening to you? Trauma effects on the brain. Chronic trauma affects amygdala, hippocampus, prefrontal cortex. So you want that increase the threat detection, increase memory changes, reduce emotional regulation. So trauma-focused cognitive behavior therapy is indicated for children and teenagers. It treats trauma memory, cognition disorders. It improves coping skills. Cognitive process therapy is used PTSD and focus changing the trauma related belief. Examples include I am responsible for what happened. Prolonged exposure therapy. Repeat controlled exposure to reduce trauma fear. Eye movement, desensitization, and reproducing. Used by bilateral stimulation, trauma memory process. Evidence-based psychotherapy for depression disorder. If the patient has a depression disorder, if they have a mild depression disorder, first line of psychotherapy will be cognitive therapy and personality therapy. And you want to monitor the response. If they have a moderate to severe depression, you want to combine medication with the psychotherapy, and you want to monitor treatment resistant. If that is happening, you want to add the medication with other medication, and you want to advance biological treatments. For anxiety disorders, first line is cognitive behavior therapy or serotonin rehab SSRIs. If they are partially responding, you want to combine the both. OCDs. First line of therapy is the exposure and response prevention plus SSRIs medication. Borderline personality disorder. The first line of therapy is the dialectical behavior therapy with medication. Medication is only symptomatic target. No medication treatment the core personality structure. For substance usage disorders, first line of therapy is the motivation interviewing plus cognitive behavior plus medication when indicated. Psychosis treatment include antipsychotic medication, family therapy, education, and social skills rehabilitation. Psychiatric integration with the psychopharmacology include combination of a treatment, medication that targets neurochemical symptoms, psychotherapy targets cognitive pattern, behavior, relationship, coping skills. If the patient has a major depression disorder, the medication will improve biological symptoms. Cognitive behavior therapy will improve the negative thinking pattern, behavior activation, and restore the function. So, first rule is cognitive behavior therapy is the first line of psychotherapy for many anxiety disorder. First rule, dialectical behavior therapy is strongly associated with borderline personality disorder. Second rule is exposure and response prevention is the first line psychotherapy for OCDs. Fourth rule is motivational interview strongly indicated for substance usage disorder. Trauma-focused therapy are the first line treatment for PTSD. Now we have a patient with personality borderline. We have a person with borderline personality disorder and has a repeated self-harm behavior and emotional instability, which therapy has the strong evidence. Dialectical behavior therapy. Dialectical behavior therapy targets emotional dysregulation and self-harm. We have a patient with OCD and has contamination fear and excessive washing. What is the best psychotherapy? Exposure and response therapy is the response prevention is the best therapy for this patient. We have a patient with alcohol usage disorder and is ambivalent about stopping drinking. Best initial approach is motivational interview. Psychotherapy is a core psychiatric intervention based on measurable changes: brain function, cognition, behavior, relationship. If the patient has a depression, you want to implement cognitive behavior therapy, interpersonal therapy. If the patient has anxiety, you want to implement exposure therapy with cognitive behavior therapy. If they have OCD, you want to implement exposure and response prevention. For borderline personality disorder, you want to implement Dialectical behavior therapy. If they have a trauma, you want to implement trauma focus cognitive behavior therapy, cognitive process therapy, prolonged exposure. If they are having a substance usage disorder, you want to implement motivational interviewing with the cognitive behavior therapy. If the person is schizophrenic, you want to implement family psychotherapy, family psychoeducation, and rehabilitation. Medication changes neurobiological. Psychotherapy changes cognition, behavior, relationship, and coping skills. The highest quality psychiatric care integrates both the psychopharmacology and psychotherapy. Thank you for joining me today. Please prescribe and join me again. Thank you.